Hi everybody, Dr. Sajic here again from Derma Skin Institute, coming to you after my carbon dioxide laser procedure. So you've just seen how I did. You see what my recovery was like and how we did it, sort of thing, with the whole experience of the CO2 laser. So was it worth it? I absolutely think so. I think my complexion is much better. Everything's looking better. I think as far as any one laser is concerned, for someone like myself who's over 40 years old and you're starting to see a lot of this pigmentation associated or a little precancerous actinic keratosis, there's no single better laser than it for numerous reasons. The number one being really is the DNA repair. So we know when we start getting into sort of these aging related pigmentation and we have it from the sun, from all of the exposure, we know that our skin cell is not only just looking not its optimal, but it's actually the function of those skin cells is not as best as it could be, because all of that sun exposure has actually gotten our cells into something called senescence. Okay, so you'll see a bunch of articles on it. There's more and more data, more and more research on senescence being a key marker of shutting down our cellular response, making us age faster, and also actually making us more susceptible to precancers and cancerous lesions. Okay, so what ablative lasers like carbon dioxide laser, like erbium YAG lasers are able to do is actually not only make us look better, but actually repair the DNA repair enzyme processes to a certain extent so that it minimizes how much damage we have, and also how our skin cells are able to process and eliminate some of the damage that we get through activities like being outside, getting exposed to the sun, and even blue light from this very screen. So for me, I know about the blue screen, so I've put on a filter on this phone, and you should do the same, because that we know can also contribute to aging and actually damage your DNA as well. So overall, I'm very, very happy. I think my complexion is much better. It's tightened my skin a bit, and the pigmentation that I was sort of experiencing is much better. So are my wrinkles, and I know my skin cells are healthier. So I'm overall very happy. As you know, obviously the downtime is an issue for many people, but for me it was quite tolerable. There was a little bit of pain and swelling initially, but after that, very well tolerated. So if you're okay like looking like Deadpool for a little bit, and you know there's gonna be benefits to it, I look at it, it's sort of like going to the gym and for your dream skin. Really, at Derma Skin Institute here, we're very much big believers of that. No pain, no gain, just like exercise. And so I'm all for it. So what doesn't it do? So no laser is going to do everything. You know, if you're looking for optimal treatments, and based on what your decisions are, is it for sun protection? Is it for looking better? Is it for sort of preventing father time? That last one's a big goal for me as well. You need to add things. So it doesn't build elastin, so that's the stretchy part of your skin. For that, there's other things like dilute radius is one. There's also radiofrequency microneedling, or even just radiofrequency to a lesser extent, but that can be done as well. So things like Morpheus 8, for example, would be a great add-on to this procedure, and many patients choose to do that. So we'll be going through that in another video, but for now we're focusing on CO2. So once we get to where we want to be, the biggest thing is also maintenance. Many patients are asking, many people are asking, you know, how long does this last? Well, it depends on what you do. If you're really sticking to your vitamin C, sunscreen, and retinol, it can really prolong when you need to do it again. And generally speaking, we sort of say 2 to 5 years before you need to repeat this particular procedure. And in addition to the creams, there's other things you can be doing. So what we call a Hollywood laser peel, for example, where it's a lunchtime, you don't even know you had it done. It's called Clear Lift or something similar to that. If you do that every sort of 4 to 6 months, it can also help delay the need for it later on. Other things like microneedling, for example. So that's where we just go in with just regular needles, or even radiofrequency assisted microneedling, again, if you really want that elastin. But microneedling on its own can really, again, get the wounding process. It's controlled wounding, just like when you're exercising, you're wounding in your muscles. That's why actually they grow bigger, is when they repair themselves. Same with this. If we're doing it in a controlled way, anywhere between every 3 to 6 months kind of thing. So at a time you're getting your Botox done, for example, or Dysport, adding something like microneedling can really be helpful. So all in all, it's really important to take care of your skin. Do your best that you can. Stay tuned for more informational videos, and take care.